As we look at the various components of health plans and what's driving costs, the one that gets our attention all the time is prescription drugs. Ultimately, we need to realize with prescription drugs, we're purchasing a commodity, something that we can buy in many different ways from many different sources, and our goal is to find the way to do that most cost effectively. The rising cost of prescription drugs in 2025 is not new news. This was the same story in 24 and 23 and even 22 before that. As we peel back the onion of rising prescription drug costs, the one area that's gotten the most attention over the last 3 years, and we expect that will continue into 2026, is GLP-1 medications. These are your Ozempics and your Wegovys, the weight loss medications, also used to treat diabetes. For the last 3 years, all we've been able to say about GLP-1s is that more and more people are taking them and the costs continue to go up. What I'm really excited to share with you now is we anticipate the message might change significantly in 2026 for a number of different reasons. Love him or hate him, President Trump announced a couple weeks ago that there's been a significant breakthrough on the price of GLP-1 medications in a number of different ways. Starting in late 2025, TrumpRx.gov is going to hit the internet. TrumpRx.gov is a place that individual consumers can go to buy a number of different prescription drugs, specifically though GLP-1 medications. The Trump administration has negotiated with both Eli Lilly and Novo Nordisk, the primary manufacturers of the GLP-1s, to bring the price down of these dramatically. Generally speaking, the direct-to-consumer solutions through the manufacturers today cost members about $450 a month to buy these GLP-1 medications. Through TrumpRx.gov, starting in late 2025, consumers will be able to access these medications for $350 a month, and over a 2-year period of time, the cost of those medications is going to come down to $250. That's a pretty significant breakthrough and almost 25% reduction in cost for these medications, where most health plans don't cover them for weight loss. In addition to the announcement from the Trump administration of the new pricing available for direct-to-consumer GLP-1 access, on November 21st, both Eli Lilly and Novo Nordisk announced new direct-to-employer solutions as well, through both Waltz Health and 9am Health. We are anticipating that the pricing available through both of these vendors to employers is going to be somewhere in the same range as the TrumpRx.gov pricing, somewhere between $350 and $250 a month. What's really important about this is the first time that we're aware of where manufacturers are bypassing the traditional PBM supply chain and going direct to employers. We think this could be a game changer where both employers can now reduce the cost of medications dramatically for their health plan, but also increase access to these very important medications for their plan participants. Finally, the third big development we anticipate in 2026 in the GLP-1 marketplace is both Eli Lilly and Novo Nordisk will be releasing oral pill forms of GLP-1s. It is anticipated that these new pill forms of GLP-1s are going to drive up demand because there's been a number of folks who've been resistant to using GLP-1s historically because they don't like the fact they have to give themselves an injection. The pill form is going to be far more accessible to individuals, and it's anticipated far more cost-effective, ranging somewhere from $150 to $250 a month. So while GLP-1s have been the big news over the last few years because of the impact they're having from a cost perspective on health plans, we anticipate that to shift somewhat in 2026. The new conversation is going to be who has access and how. Are employers encouraging employees to leverage TrumpRx.gov and to buy the medications themselves, or are health plans starting to pivot and add coverage for weight loss medications to their plans as well? In addition to the big developments on the GLP-1 front, both from direct-to-consumer, direct-to-employer, and in pill form, we anticipate one other significant influence on prescription drug prices to take effect in 2026. As part of the Inflation Reduction Act a number of years ago, the federal government started negotiating with pharmaceutical manufacturers. Their focus was on some of the highest cost medications that Medicare was paying for, and they started establishing much lower prices for these medications. So in 2026, we're finally going to start to see the impact of the federal government flexing its purchasing muscle when it comes to prescription drugs. We're excited about pharmaceutical manufacturers going direct to employers and bypassing the traditional PBMs. And we're excited about consumers having the opportunity to buy directly from manufacturers at much more cost-effective options as well. Thank you very much for joining me today. We look forward to connecting in 2026 and helping you find ways to navigate the ever-changing employee benefit landscape in Michigan.